I'm Swapnil Hiremath. I'm a nephrologist from the University of Ottawa in Canada. And our special guest today is Dr. Niteesh Choudhry.
Thanks for having me. I am a professor of medicine at Harvard Medical School and the Harvard School of Public Health. I'm an internal medicine general internist hospitalist by clinical practice.
How should we be thinking about non-adherence in this setting? Some people have pointed out that perhaps it's also inertia on our aspect, right? It's some therapeutic inertia, perhaps. What do you think about that?
I think you're totally right. I'll add a slight color to this. So across studies, we think that non-initiation or therapeutic inertia, non-prescribing by us as clinicians, frontline contributors, is every bit as common, if not slightly more common than non-adherence by patients, at least in the case of hypertension. In other cardiometabolic conditions, that balance skews a little more to non-adherence than to non-prescription. But of course, in hypertension, we're generally talking about multiple medications that have complexities and interactions and their unique side effects. And so prescribing is a little bit more complicated than, for example, statins in the case of hyperlipidemia. And so I think we first need to acknowledge that there is more than one thing. It's not only the patient. And several years ago, I wrote about stop blaming the patient. And I think that's really what we're talking about here. But what I would add to that, and at least from my personal evolution of thinking, is that if you think about these behaviors, if we thought non-prescription or inertia, that's a doctor problem. And if we think about non-adherence, that's a patient problem, that characterization is incomplete. We negotiate with our patients and come to therapeutic agreements. Some people are willing to accept treatment if we recommend it. Some people ask us to initiate treatment. And so even the act of initial writing of a prescription is not exclusively a physician task. And conversely, if a patient experiences side effects, medications are too expensive, they have some other undesirable attribute, then they can't continue to take that medication with our help in terms of changing it. And so it's not just them taking their medications, it's our partnership with them continuing along. So all this to say is that I very much agree that it's more than non-adherence. And the interplay between doctors and patients really applies to both non-initiation, non-intensification, therapeutic inertia, as well as non-adherence.